Hey everyone, this is Dr. Rhett Scherschlicht, and he's super excited to be talking to us today about diabetes mellitus. So, Dr. Scherschlicht, will you tell us a little bit about you?
Sure. I'm Makaylee's dad. I'm a dentist in Sugar House, Utah. Been a dentist for almost 25 years. Do mostly general dentistry, but also do some bone grafting, implants. Been doing implants for about 26 years. I don't know. That's about it. I've got 5 daughters. I coach soccer along with doing some dentistry, and that's about it. That's me.
Okay, and so our first question about diabetes mellitus is, what is it?
Well, it's also can be called diabetes, just diabetes straight up. It's a disorder where you can't regulate your blood sugar very well. There's a couple different types. I believe type 2 is where you can't regulate your blood sugar very well, and type 1 is where your pancreas can't really regulate insulin very well. So when you can't regulate the blood glucose or blood sugar, then it can lead to some serious problems, short term as well as long term. Short term, you can black out, you can kind of space out. You could, obviously, if you were driving a car, you would probably end up in a wreck, could probably die. There's been cases where people have passed out in stores, or, you could have too high a blood sugar. Most problems occur when the blood sugar is too low, but too high isn't good either. Long-term effects could be like organ failure, loss of appendages or digits because of lack of blood flow to the appendages or to the organs.
Okay, and have you ever had a patient at your office who has had diabetes mellitus?
Oh, yeah.
Can you tell us a little bit about her?
Well, the patient you're referencing that we've talked about in the past, I've been treating her for just about my whole entire dental career. Initially, she kept her diabetes under pretty good control. She doesn't have a pancreas, so she is what's called a brittle diabetic, but still diabetic nonetheless. We were aware of her problem, but we would have her monitor her blood sugar levels through appointments. What we found is that longer appointments were hard for her because it was harder for her to control her blood sugar for a long period of time. But we would always make sure that she ate before she came and that her blood sugar levels were good. We tried to keep her appointments to an hour to an hour and a half. And what we found is if they were longer than that, she would get these low blood sugar levels where she would start to just kind of phase out. Like she would just get this blank stare. She would start to talk like really weird, like she was confused, like she didn't know where she was. She was completely disoriented. What we found is that she had some glucose tablets, which we would give to her at those appointments at that point. And we usually had to stop working on her and just let her blood sugar levels start to increase so that she wasn't so disoriented and really just kind of spacey, like she would just look off in the distance and not even really, she'd just stop her conversations. It was really bizarre. But once the glucose levels came back up, she was back to her normal self. And but then we had to usually at that point, we'd usually stop the appointment if we could, or we'd finish as quickly as we could, and we'd have her sit up in the front office area and get back to normal until we had her glucose levels pretty well normalized for about an hour. But then we also found out that she would leave appointments, and one time she ended up in Walmart and passed out in Walmart. One time she left an appointment and went to Walmart and I guess she loved to go to Walmart after appointments, but then on her way home from Walmart, she ended up getting in a traffic accident, totally in her car. So she started having her family members bring her to appointments. And like I said, we would always have her glucose tablets ready. And we really just had to keep her appointments to about an hour to an hour and a half. Hygiene appointments weren't a problem, but if we had any restorative work that needed to be done, then we had to really schedule her at appropriate times during the day where her blood glucose levels were more manageable and where she could manage them, because bottom line is she's never died on her way home in a traffic accident or anything like that, but we don't want to have that ever happen to her and be liable for that.
Okay, and with this patient, is there anything that you or your staff does to prepare, or what is the process of the dental appointment for this patient? Is it the same as regular patients, or do you guys do something different?
As far as the setup, no, it's the same as a regular patient, but as I mentioned before, we make sure that she has her glucose tablets with her, or we have some kind of a glucose supplement. We make sure that that's ready, not just like, hey, we have to have someone run and get it. Like, it's ready to go, because when she goes into her diabetic, I don't know if you want to call it diabetic shock or insulin shock, or basically just low blood sugar situation, she becomes very disoriented, very, just like I said, really spaced out. Like, she stares off into the distance. She quits talking. She doesn't really acknowledge or know where she's at. She becomes very disoriented. So we have to be ready for that when that occurs.
Okay, and then what are some things that you would recommend to us as future hygienists to help these patients with diabetes mellitus to have a more comfortable and enjoyable dental visit?
Well, I would kind of like what I've already mentioned is definitely keep the appointments to shorter appointments. Make sure that you test the patient's blood glucose levels before and after the procedure, after the cleaning, after the restorative procedure. I'd make sure that you have a glucose supplement on hand. Obviously, if you take the blood sugar levels before the appointment, you'll know if the blood sugar levels are low or high, and what to do in either situation. I'd probably also sit down with the patient and see if they have certain periods of time where their blood glucose is more manageable. Usually for most diabetics that aren't a brittle diabetic like my patient, the blood glucose levels are a lot more manageable. And usually they can manage them with foods they eat, their diet, and you just got to make sure that they have things under control before and after their appointment, because you don't want to send them home when they're kind of on the borderline and then they have an accident on the way home where they could kill themselves or kill other people.
Yeah. And then
the other thing too, it happened once with this patient, is she went into a seizure, had a seizure in the chair. And if that ever happens, we were luckily able to just keep her in the chair, and we got the oxygen out and put her on just straight oxygen, but we turned her on her side and we were able to hold her in place so she didn't fall out of the chair. But after working on her for 20 plus years, I'd never seen that happen with her, and it did. And so we were able to manage it in the chair, but it is definitely a scary situation.
Mm-hmm. And then to close, do you have any words of wisdom to us future hygienists, or any tips or tricks for us?
I'd probably say the biggest words of wisdom or tricks would be to practice routinely office emergencies, role play, maybe go through them every 6 months, maybe quarterly if you want to, and know what to do in those certain situations, because there's a lot of different medical emergencies that can happen in your office. Diabetes is just one, but the more familiar you are with your your medical emergency kit, your defibrillator, how to use it, how to put it on. Those emergencies become a lot more manageable and a lot less scary, but you have to practice. I, for a lot of years, didn't, and luckily never had an emergency, but we quarterly, if not about every 6 months, go through medical emergencies, and we usually spend an hour and a half, 2 times in the month's period of time to go through all the different medical emergencies in our office. And it's also good to go through your medical emergency kit, make sure that nothing's expired. Usually you can update those every year, but make sure your EpiPen is current. Make sure you have all your little vials. Make sure you have hypodermic syringes. Make sure you know how to get into the little glass vials and withdraw whatever drugs you need to give to your patients, and depending on whatever their medical emergency is.
Okay. And do you have any inspiring or any more thoughts to encourage us to get through this hard time of hygiene school?
Well, I mean, you got to put in the work. It's a lot of hard work, and I'm assuming that probably a lot of you have done observation and you know what you're getting into. But everyone has to go through school. You have to get through it, and but the more you learn in school, the easier it's going to be once you get out. And the more you learn in school and the more prepared you are, the better hygienist you're going to be when you get out. But that doesn't just come real easy for everybody. You do have to work hard, and that's just kind of the way it is. I've always found that you have to work hard for the things you want. And when you do, you get that degree and you hit the ground running, and hopefully you find a great office to land in and work under a great dentist that holds you to high standards and holds you to taking really good care of your patients, because that's, I assume, why most of you do this. You do have to take care of patients, and you have to know how to treat them. You have to know how to handle them. Not everybody's the same, but you can make a huge difference in somebody's life. I mean, teeth are super important. Oral health is super important. It can lead to other problems in the body. And if you can, help even just one person every now and then diagnose a problem with their mouth, or an oral cancer, or high blood pressure. I mean, even these little things, you really feel like you've done a service to people, and people remember that, and they're loyal, and they want to come back to you. So, the higher standard of care that you hold and that you hold your patients to, it's really going to pay off in the end. I know it seems like a pain. You have to probe everybody. You have to mark, bleeding. You have to stage the disease. You have to classify the disease. But the more accurate you are in that, and the more thorough you are, the easier it is to explain it to the patients. And long term, if you can help somebody save their teeth, it's really more rewarding than you can ever realize.
Okay. Well, thank you so much for answering these questions, and you're the best.
You bet. Good luck, and happy to help out. Thanks.